of course, with no audience for the reasons we all know in these very strange and rather frightening times for all of us. And instead of our usual 5 panellists, we have 4 in order to have suitable social distancing.
Good evening. I'm a local GP, and unfortunately I've been having to self-isolate for the past week and a half. I've not been able to get remote access to be able to work from home. There's been no testing for NHS staff, and my colleagues on the front line have had to go and buy their own scrubs and eye equipment from DIY stores because the personal protective equipment has not been adequate. I would have thought that these were problems that could have been anticipated and dealt with in advance. I would like to know what specific problems people expect the NHS to have in the next few weeks and months, and what they think can be done in advance to sort them out.
So, Richard, there's 2 aspects to this, isn't there? A, how have we got to this point, and was enough done to stop us getting to this point? And is there anything coming down the track that we need to be preparing for now?
Well, first of all, I receive 20, 30 messages a day from frontline NHS workers across the country telling stories very similar to what Adam was just telling us. And honestly, it's sorry to say this, but it's a national scandal. We shouldn't be in this position. We knew in the last week of January that this was coming. The message from China was absolutely clear that a new virus with pandemic potential was hitting cities. People were being admitted to hospital, admitted to intensive care units and dying, and the mortality was growing. We knew that 11 weeks ago. And then we wasted February when we could have acted. Time when we could have ramped up testing, time when we could have got personal protective equipment ready and disseminated. We didn't do it. I'm hearing that not just personal protective equipment is not available, it's the wrong kind of personal protective equipment. What we have isn't even WHO standard. We're putting our health workers, who we've just all clapped here, in the front lines without the armour they need to defend themselves. They're wearing surgical masks which are not WHO standard. They're wearing thin plastic aprons which are not standard. And they're wearing rubber gloves which only cover their wrists, exposing their arms to danger, jeopardy. That is nothing short of a national scandal. How could we allow this to happen? The hypocrisy of clapping NHS workers and yet the government not supporting them to go into that front line is tragic, and it was preventable. I'm sorry to say, but it was preventable.
So, Robert, we had the Secretary of State for Health on the programme last week, and I questioned him pretty closely about supply of equipment, and Matt Hancock was saying innumerable numbers of lorries were going to be out over the weekend. So obviously we were on Thursday. He said by Sunday, all the hospitals, as far as he could say at that point, all the hospitals will have sufficient personal protective equipment. Here we are, a week on, and no, they don't. And you've heard what Richard has to say.
Well, this is a big challenge, but we are ramping up supply very rapidly, and I'm sorry to hear there's a problem at Shrewsbury Hospital.
Well, you can't be surprised by what you heard, because we've all been hearing it
ever
since last week.
I hear that myself, and I'm the Cabinet Minister responsible for local government to look after social care. So I hear it from social care providers as well, because we need to get this equipment not just to hospitals, but to care homes, to pharmacists, to GPs, to people who work in homeless shelters, many different important settings. But we are now getting very significant quantities, tens of millions of items of equipment, from gloves to face masks and to other items of PPE, are now flowing through. This has become, for us, a military operation. You've seen some of the pictures of the armed forces delivering this to hospitals. Supplies are now
Richard
flowing
is shaking
through.
his head there.
Well, that's just the case. Supplies are flowing through to hospitals.
OK, well,
now.
tell us tonight, Robert, tell us tonight, because people watching at home, and a number will be GPs or working in the healthcare system of social care. When do you think people who need it in the health system will have the correct and sufficient personal protective equipment? When will that be?
Well, I can't give you an exact time. What I do know is that...
So you don't know?
No, well, what I do know is that in the last 48 hours, for example, 25 million packs of gloves have been delivered, 15 million face masks, almost 2 million items of eye protection. So these are very large quantities of equipment.
Sorry,
we probably need much more than that, but we are ramping up production.
I know you think what you're saying is true. I know you believe it, but it's simply not true. I mean, these are the messages that I've had today. The lack of clear guidance and testing is causing huge anxiety. Totally inadequate PPE, being sent like lambs to the slaughter. Inadequate PPE, no scrubs, no testing equipment. Sleepwalking into this totally unequipped and unprepared when we had the luxury of 2 months to prepare that other countries didn't. That's why it's a national scandal.
Well, we need to get much more equipment out there. That is happening. Primarily now, PPE is a logistical question. We've got very large stocks. We need to get it out to the front line. On testing, we're also increasing the amount of testing that's available. Again, we need to go further because this is all about testing. One day last week, I think we reached 8,000 tests. We're averaging somewhat below that. We want to get up to 10,000, then 25,000, ultimately 250,000. There's a huge effort to be done there. And then on the antibody test, which is the other type of test for people who've already had it, there we've ordered 3.5 million of those tests. We're testing the test to ensure that it's reliable. And clearly, as the Chief Medical Officer said, that's very important. There's nothing worse than an unreliable test. But if we can prove that that is reliable, then we have millions of those flowing, and within weeks they should be within the system.
Well, let's just stick to the personal protective equipment for a moment, because that's what Adam was asking about. Humphrey, what's your view on that?
Well, look, firstly, I think what I have to say to Adam, again, a huge thank you for everything that he and the hundreds and thousands of GPs who are in many situations right in the front line of what's going on here. And I've got good friends who are GPs who are doing tests of patients and checking patients in the car parks of their surgeries because it's not safe to bring them inside, who are working double, triple and quadruple shifts sometimes. So a huge thank you to what's going on in that regard. I have to say I have a lot of sympathy with the views that Richard expressed, which it's hard to understand why we got caught as short as we did in this crisis.